I've been reading about what killed Lauryn Hill, the freshman basketball player from Ohio who passed away Friday, and it's called diffuse intrinsic pontine glioma. DIPG. And DIPG basically is a type of brain tumor that generally starts at childhood. Lauren was much older when she was diagnosed with this tumor, but reportedly what it does is it starts in the pons area here of the brain and right there, and this pons area controls your breathing, sight, and eating, basically your primary bodily functions. And as it grows, it makes it difficult to breathe, to eat, and to see over time. Because of where it's located and the difficulty to get to this tumor as it grows, it has been declared inoperable because if someone or a group of doctors tried to operate on it, the fear is they would cause damage that would be irreparable, and it wasn't known exactly systemically where that damage would be. However, I did find a bit of a ray of hope here, and that's in what happened with Haley Olson. Haley Olson is a youngster who was diagnosed with cancer on November 29th of 2011. She was diagnosed with DIPG, Now, radiation was such that the tumor, as it's reported here, got smaller in size from 6 weeks of radiation, and at the time this was written, she was stable with over a year of chemotherapy. Now, what I found intriguing about the brief, small amount of research I did online here is this article called A New Approach to Old Ideas About Diffuse Intrinsic Pontine Glioma. And this group of doctors, led by Mark Kieran, as you can see here, that's Haley Olson with Mark Kieran and Susan Chi. This group of doctors dared to believe that they could actually operate on something called inoperable. And Dr. Kieran says here, for 40 years, we didn't have the surgical techniques to safely take a biopsy of DIPG. But now there's a clinical trial such that they do. It was part of the dogma, as he says here. And his clinical trial takes advantage of what he says is the last 40 years worth of advances in neurosurgery and our understanding of the biology of cancer to target and personalize DIPG treatment. Haley was the first patient. Now, they proved it work, and the trial is currently open only at Dana-Farber Boston Children's. And sadly, that was not where Lauryn Hill was. So the clinical trial, I'll highlight it more here, that was done. It's a little slow to open. There. Is called molecularly determined treatment of diffuse intrinsic pontine gliomas. And the proposal is to conduct a biopsy, and the location is determined by the treating neurosurgeon at the designated participating site with the goal of minimizing procedural risk. The following biopsy, all patients will receive a local radiation therapy that consists of 59.4 GY delivered using conventional conformal or other standard treatment planning with adjuvant bevacizumab. Radiation planning can be begun with the preoperative images. So this is a detailed description of the clinical trial. This was the clinical trial that was used on Haley Olson. Generally, someone with Dipg is given between 3 and 9 months to live. Haley was diagnosed with this November 29th, 2011. Sadly, she passed away September of 2013. But consider this. She survived that long. And what I can't find in the literature here is some explanation of the operation's impact and its ability to slow down Dipg. That's what I can't find here. Right now, $2.5 million has been raised since Lauryn Hill was announced as having this problem and wanted to play basketball anyway. Prior to Lauryn Hill's announcement, over the last 7 years, $2.8 million had been raised. It's a dramatic difference. So there's a long way to go, but the question I have is, why didn't Lauryn Hill get this treatment? She should have been next, because this article is dated May 30th of 2012. We've got to really get aggressive about attacking this stuff.